Hi, everybody. I wanted to thank the organizers of the 23rd Bangkok International Symposium on HIV Medicine for the opportunity to present today. As noted, my name is Stefan Burrell. I am on faculty at the Johns Hopkins School of Public Health in the Department of Epidemiology. I co-lead our training programs in implementation research, and I will be talking to you today about those approaches with a talk titled Leveraging Implementation Science Frameworks and Approaches for Adolescent HIV Care Programs. In terms of an outline for today, I'm going to start by talking just a little bit about the characteristics of implementation methods and specifically the use of those methods in the design of programs. I'm then going to talk about measurement of implementation in terms of how we analyze as targets, how we use measurement to assess current strategies, and even thinking about new strategies in program development. And then I'll talk a little bit about the research elements in terms of what are some of the approaches in a very brief manner that we can use to evaluate implementation, and how do those differ from the sorts of approaches that we use to evaluate effectiveness, and then close with some thoughts. So I wanted to start by talking a little bit about characteristics of implementation methods. And I want to do that by really thinking about the sort of traditional translational pipeline. And I think while we've seen over this year how quickly this pipeline can work, often we think about initial work being, could a program work? Even in the most hypothetical settings, could a program work? And those tend to be pre-interventional studies, in vitro studies, for example, where we're even thinking about can PrEP, even in the most hypothetical sense, work? We then move into research and evaluations that are focused on, does a program work? So these are real world effectiveness studies, for example, and many of those have taken place around HIV treatment, around PrEP, in terms of, does this program work? If we take this idea and put it into practice, does it work? I think increasingly what I'd like us to think about now is, how do we make a program work better? And that's really the focus around implementation. And that's what I'll be focusing on today, is that you have a program, whether it be an adolescent PrEP program, adolescent treatment program. It exists, and now you want to make it work better. This is a commonly used framework to really use to consider both implementation research as well as programming and the planning for programming. And so on the one side of it, you can see where it says what, you see evidence-based interventions or empirically supported treatments. These could very well be PrEP or treatment. They could also be condom negotiation skills or community-based programming. On the other side, you can see health outcomes, and these could be individual or population level health outcomes. They could focus on symptoms among clients, among satisfaction of programs. But there's a whole series of things in between there that we may really want to consider when we think about, does a program work? So I think folks have also looked at service outcomes, including efficiency and safety and effectiveness, equity, for example, patient-centeredness, the timeliness of programs. But what I'd like us to focus on today are really the questions about implementation strategies. So how do we take a program like PrEP or treatment, and in a very specific way, what are the interventions that we're looking to use, and how are we going to evaluate those interventions? And that's really where these implementation outcomes become very useful in the context of your programs, in terms of the feasibility of your programs, the fidelity, the penetration, the acceptability, the sustainability, the uptake, the implementation cost. It's those two elements that I'm really going to be focusing on today. And I'll note that implementation research, and really this focus in the context of programs, really emerged based on the fact that there is a disconnect between the expectations of a program in terms of what we would expect PrEP to have achieved in real world settings, and ultimately what happened in real world settings. And we use these implementation outcomes in the context of programs and research to evaluate implementation effectiveness. In other words, effectiveness of your implementation strategy. And it's really a key intermediate outcome between your traditional sort of individual and population level health outcome and what you actually did in terms of your program. You can measure them quantitatively or qualitatively, and you can measure them from the perspective of clients or providers, in addition to also using more user-based in terms of individual network or regional level analyses. So I'm going to use PrEP as an example to really consider in terms of thinking through real implementation issues. And so we know that if folks are highly adherent, it works really, really well. It even works up to 50% with moderate adherence. We know that it's underused among adolescent key populations. We know that uptake is far from optimal. So the traditional approach when you're thinking about designing a program, and I'll apologize for the way that this slide looks, it clearly something went wrong when I uploaded into the recording software. But I'll note that when you're thinking about like designing a program to improve PrEP uptake among adolescent populations, the normal approach is that you apply your personal experience, which might be very good, that you might have a really good understanding of why the program isn't achieving what you want it to achieve and what is it that you might be able to do to improve that. You might call a friend. We often think of this as the who wants to be a millionaire approach. So you might call a friend who you think is very smart, and they may have a really solid understanding, and you can try something. You can write a proposal or actually implement a program. You might find that it doesn't work, or that you're not, it's not well regarded. And so then you think about doing some formative research to try to understand it. And if by chance you might find out what the actual issue is, unfortunately, you may find out that like people just describe sort of general common barriers, and you don't get something that's specific enough that you can really intervene on. And then you're at the point where you think, okay, I need to systematically assess what is wrong with this program and how to approach the problem. Now, what I would like ideally is that at the end of this talk and moving forward, you might use a different approach. That when you have this gap between evidence and practice in PrEP for adolescents, that you consult frameworks that I'm about to talk about or theories in implementation science, and you think about those in terms of like what might be the specific barrier to PrEP uptake or PrEP use in general among adolescents. You might think about really sharpening your implementation diagnosis. What is the specific issue to really help you understand that what is it that you would like to do about it? You really think about like developing an implementation diagnosis, just like you would a clinical diagnosis. I know many of you are clinicians. And then you can either propose research or develop a program to specifically address that implementation barrier and that implementation gap. So when you think about using implementation science to develop your program, again, characterizing the implementation gap, what is the element that is not being delivered is fundamental to that. You want to describe the constraints to bridging that gap. Do you need a better understanding of the gap with pre-implementation research? Can a model help you? You want to finalize the strategy. What is it that you are specifically going to do and really specify that intervention? Are you going to educate people? Are you going to reimburse providers differently? Are you going to advertise differently? To think about using an appropriate logic model to really underpin your strategy. We'll talk about some of these implementation frameworks that you can use for either the planning or the evaluation of your particular strategy. You can think about, have you considered generalizability or even the context in which you're working? Is there an evaluation framework in place that can help you understand the successes of your actual implementation program? And also really have clearly described implementation outcomes. That I think if you think about these in the context of a program, that you can develop a really solid and specific strategy to address a really clearly defined implementation problem. So I know many folks get concerned when we start talking about implementation frameworks, but I'm just going to talk about them very briefly and introduce them as tools that you can use in designing a program, not just a research study, but really in the context of a program. in terms of implementation planning and process frameworks, implementation determined frameworks, implementation evaluation frameworks, and then I'm just going to touch on theories and implementation research. And I know many clinicians and practically oriented folks get concerned when they hear the word theory, but I'm just going to say it in the most briefest of ways because it may be useful to you in actually designing your program. And I think, ideally it would be. So I just want to start by talking about implementation planning and process frameworks. And the reason that these exist is these are folks who have thought about like, what are the specific barriers that are impeding a program from achieving what we wanted to achieve? And there's a bunch of different tools there. There's the exploration, preparation, implementation, sustainment framework, and knowledge to action, the re-aim, as we'll talk about later. But each of these tools actually exists in order for one to think about like, what are the various elements of my program in the most specific of ways? So moving from just saying, listen, we're going to implement PrEP in a community-based clinic, but getting in a very specific way of like, how are we going to implement it? What are the specific elements that we're trying to overcome in order to make the program better? And because we've now have enough experiences, we've noted that like if we just make it available, actually people may not come. And we have to really get very specific about how we're going to implement it. What is it that we need to do better in order to get more folks into our programs, using our programs, and thus benefiting from our programs? Now, implementation determines frameworks build on this. These are the domains that have been recognized as important for implementation. And the most commonly used ones are the CFAR, the Consolidated Framework for Implementation Research, and the Promoting Action on Research Implementation in Health Service. And I'll note both of these have the word research in them, but actually they really are useful for programming. So that, for example, if you were to diagnose like what is not working in your particular program serving adolescent folks either living with HIV or at risk for HIV, one can really diagnose, is it the providers, is there a challenge, are they not educated enough, are they not reimbursed enough, is it the clinic in which they're working, is it the actual intervention, is it how they're messaging it, that you can tease apart each of these elements into the sort of the underlying constructs. And then you can think about, well, what is it I need to do better, again, to align the sort of the promise of PrEP or ART, STI management, mental health support, community-based outreach with the promise of those particular interventions. And then just to briefly say that there are also implementation evaluation frameworks that normally we just evaluate, sort of process indicators. I mean, how many education sessions did we have, or how many condoms did we distribute, or something like, like an outcome, like HIV incidence, did it go down, for example. But what I'd also like to encourage you to do today is to think about, as you're going to be evaluating your programs moving forward, how are you actually evaluating like your actual strategy? So if you did an education program, are you also evaluating the education program as an intermediate indicator in terms of people's quality, the reported quality of a program, for example, and then even more so like the health outcome? So what I just really want you to think about is like, are we specifically evaluating, the actual intervention that we did in the context of a program? And then finally, I'm just going to briefly say the word theory. And I only say this because I think it can be useful to think about using these theories to say, well, why do you think this program would work? Right? So you went through that process earlier, and you have an implementation diagnosis. You really have a solid understanding of why it's not working. You don't think that providers are reimbursed enough, for example. So then you think about a program that's going to address that. And the theories can help you say, well, I think this is going to work because of this. That's a why question that often quantitative work can't do. So, and it can also help you predict, do you think this is going to work to address this issue? So one that's commonly used, for example, is a normalization process theory. And you can use that in adolescent programs to say, do we think that either providers or the program users in terms of the adolescents are going to do what we want them to do based on implementing this new practice? And so it's really, again, these are tools for you to think about teasing apart like why something may happen. So now to bring us back to this idea of like what is a strategy specifically, because that's one of the key things I'd like folks to have at the end of this talk. So an intervention, I think we use this term often. It is a combination of evidence-based program elements or strategies designed to change a behavior, for example, among adolescents at risk for living with HIV. Implementation is the use of like one or more implementation strategies to introduce those interventions into actual practice in specific settings. And an implementation strategy is a systematic process to facilitate the adoption and integration of interventions for adolescents. So I know that feels jargony. So to make that real, an intervention might be, for example, an individual provider improvement. So, we want a clinician to do better. Well, what is a strategy? Well, strategy might be different sorts of regulation, continuing education and training, accreditation, better reimbursement, et cetera. So it takes the idea of like saying, I want to make a provider better into its very specific elements. You could also say that, an intervention is, well, we want community empowerment. Well, what does that mean? Well, it might be community information and education. It might be strengthening inclusion and participation, local accountability, local organization capacity building, financial empowerment for community groups. So it's about taking the sort of general idea of community engagement into very specific strategies that you can then evaluate, again, as intermediate outcomes, that if we empower this community with better financial empowerment, for example, can we measure that? And then also, does that result in better health outcomes? So to give an example, an intervention goal may be about increasing viral suppression for adolescents living with HIV. Intervention categories could be environmental policy-based, setting in terms of like a clinic or a tertiary care hospital, a type of technique, provider, different types of resources. And strategies could be, well, for example, in a policy, you might license certain clinics to provide secondary, tertiary treatment regimens for adolescents that may not have been able to do that before. It might have just been only in the context of very central clinics. Providers, it might be funding communities of practice for allied health professionals to increase adherence to treatment programs for adolescents. And resources, it might be that you're providing checklists to support improved counseling and optimize ART choice among adolescents. So it's that you take this very sort of general idea into something very specific that, again, you would be evaluating as interim indicators and in a sort of a pathway of ultimately improving PrEP or treatment or STI management, et cetera, for adolescents. So I'll just say that I think, as we think about effectiveness research, and evaluating effectiveness, the primary research questions are generally clinic-oriented health outcomes. So we might study the coverage of an intervention and adverse health outcomes in question. So it could be like the number of adolescent people living with HIV that have access to ART that are virally suppressed. That's a common outcome, or even more so like incidence, for example. But in implementation research, and implementation evaluation, right? It is a focus on evaluating those implementation elements. So the study may focus on measuring the impact of that intervention as a marker of implementation, and only a secondary goal of like looking at client-oriented health outcomes. So as an example, your focus may be on a blended digital and peer-based education system for ART providers for adolescents. And you may focus on then like evaluating improved knowledge among those providers, and only sort of a secondary goal of like measuring improved ART choices of viral suppression. So the one message to take away is that as you're thinking about like getting very specific about using an implementation framework, that you also want to make sure that your evaluation matches that. So just a couple things that you might consider as you're planning your implementation strategy. Well, if you're thinking about PrEP use for adolescents, you might want to do a baseline survey of PrEP use using one of those frameworks to think about like, what is the barrier? Do acceptability of different implementation strategies? You might do a discrete choice experiment to understand preferences from the perspective of providers or users. As you're ongoing. You could do quantitative and qualitative use evaluation of actual strategies. So from the client provider feasibility. So you're not just asking about a prep, but for example, if you're doing an education program, you're asking about that education program. You can use program logs and audit and checklist, mystery shoppers for fidelity, for example. And then you can also think about afterwards, like the penetration sustainability, like how many folks did you reach, retain, what sites were, how many sites were implementing your strategy, and was it sustained over time, or did they do it for a little bit, this education program, and then they just went back to baseline after a while? So also just to give an example of, like a randomized control trial. So in this hypothetical example, you can see you have eligible adolescent LGBT-oriented venues that are willing to participate. And you have these two different strategies. In the one strategy, you want to provide PrEP at that community location. In the other strategy, you're referring adolescents to a drop-in center to get PrEP. The evaluation system is still, you're still going to deliver PrEP. It's not about evaluating PrEP. It's about how you're delivering PrEP. And your evaluation may be about PrEP uptake and adherence. So, in this sort of pragmatic trial, it is asking the question, what can PrEP do in the real world? Because many of us work in the real world. We are programmers, we're service providers, and we really want to understand in real world settings, how can we make things better? As compared to sort of the traditional explanatory RCT is, what can PrEP do under idealized settings? So effectiveness here would be about like understanding the effect of PrEP and reducing HIV incidence among adolescent LGBT. But actually, what I'm saying is that you may just want to focus on understanding these differential delivery strategies in terms of the uptake of PrEP with decentralized delivery. So it's just asking that question of implementation. So then just a few thoughts in summary. One, there's a couple key themes that you can use implementation science method, I think often thought of as research, but actually to help you specify your program in response to a particular implementation gap among adolescent communities. And that there are these planning evaluation frameworks that you can use to help you really design and specify that program. And then of course, there are these evaluation methods using a range of different designs that can help you evaluate both sort of the implementation as well as the health outcomes of your particular implementation strategy. So thank you very much for your attention today. Obviously, I would have loved to have joined you in person, and I hope to do that at the next year's conference and moving forward, and hope all are well and safe. Thank you.